Hello and welcome everyone. I am Megha Paradkar, Vice President of Customer Engagement at Aavenir. We have an exciting session lined up, and I'm looking forward to diving into some insightful discussions with our experts and sharing valuable takeaways with all of you. Today we have Kristen Myers and Jeff Perry from Kettering Health. Thank you for joining us today. Let's get started. To begin with, Kristen, can you help us know more about Kettering Health and your role at Kettering Health?
Absolutely. So, Kettering Health is a Seventh day Adventist healthcare system. We have 14 medical centers in the greater Dayton area. We have 210 medical group practices, about 7 urgent cares, 1,800 physicians, and 15,000 employees. I was with Kettering about 25 years ago for about 5 years, left for a short period of time, working in supply chain the whole time, and have been back with the organization for about 5 years. And currently working as the system director of supply chain for strategic sourcing and purchasing.
Wow, 3 decades. That is really a long term, Kristen. So, what made you look out for a CLM solution? What triggered to you started looking at a digital automation tool, and how did you really land up at Avenir?
Well, when I first came back to Kettering, the contracting was being done in multiple areas. So supply chain did most of the contracting that was revolving around supplies, capital equipment, things like that. Other contracts were being done in other areas of the hospital. Well, they had one system that a lot of things were being sent to store. So it was more of a storage contracting system. Nothing was being kept in one location. Legal had some things, HR had some things, then this other system kind of compiled most of the rest of it, but it was all done manually. So everything was done through a Word document, was redlined, emailed back and forth to legal, to the vendor, so forth. So there was a lack of consistency, a lack of process that was happening depending on the department. So we identified there was an issue and started working with Jeff Perry and his team on trying to identify something that would work for us. We actually went a different route. This was prior to me taking the director's position. They started down a different path at one point, working with a different vendor, and it just was not workable. It became so convoluted. The process was difficult. They tried to show it to us, and we were like, yeah, this isn't working. And we spent a lot of time and money already wasted on this other system. So I don't even remember how we came across Aavenir. Jeff may remember, but we were introduced to the Aavenir team and started talking to them. And the process and the way things were set up was more of a contract lifecycle system, and that's what we were really looking for. So that's kind of how we got introduced and started with the Aavenir process.
Wonderful. Jeff, again, taking up, the next question to you, since Kristen also mentioned that you were a part of, evaluating the different tools. So what exactly were you looking at? Again, being a manager's application on the IS business solution side, what were you really aiming for when you were looking out for a perfect tool to meet your business needs?
Well, one of the things we try to do is use common systems, and we've been on service now for 8 years. So that was a really big part of it, is that with Avenir being built on ServiceNow, it's built on a common system that we're using. So that played a really big role.
Okay, wonderful. And sorry, Kristen, you want to add something there?
So the other thing I was going to say was ServiceNow that was really important to us. It title is ServiceNow, but then Aavenir also tied into our DocuSign, which was the program we were using for all our signatures. So we could add that.
Wonderful. And then again, with these two primary differentiators, right, with ServiceNow being there, DocuSign well integrated, once we started off the rollout for CLM solution, right, what were your expectations precisely during the implementation side? As this webinar is revolving around some key takeaways around the implementation of a CLM tool, I think that would be a good segue to understand, like, when organizations like Kettering get into the implementations, what is that layer of expectation that people like you, Kristen, Jeff, you expect in that experience?
Well, I'm going to say that my expectations were probably a little naive in the sense that I kind of thought would just upload the existing contracts and roll out the program. Everything would be simple and smooth. I had never actually stood up this type of program before, so I think my expectations were a little different. What I think we found out was we had the complexity of having multiple systems to move together. Our data wasn't as clean as we would have liked it to be, based that it wasn't coming from the same people. So there were bugs that had to be worked out. So my thought was, I'll rip this stuff rather and it'll be all, easy to get, easy going. And it just took a lot longer because of the bugs that had to be kind of worked out. And we did a lot of customization to the system. During the process, we worked on doing a lot of customization to the Aavenir system. And looking back, that is something I would probably not do again, because I think we tried to adapt too much of the system instead of looking at it as a system that was pretty much ready to go with just some minor tweaks from us. Instead, that customization, I think, caused us the little bit of more difficulty than we probably needed to have.
Understood. Jeff, your point of view?
Well, I would agree with Kristen. Two of the big challenges that I don't know if I really foresaw the issues was that the data that came out of our old system, it wasn't complete, it wasn't consistent. Some of the contracts had expired, but they had not been flagged as expired in the old system. And then the opposite, we had some that had auto-renewed that were shown as expired. So when we went to try to import that data in, we basically got a lot of garbage. One of the other issues that we ran into is because of the way that we use one of our purchasing systems, we have many duplicate vendor names created that they use to say, okay, this is what the vendor that we use if it's over $500. This is one if it's an EDI payment. So all those bogus vendors got imported into ServiceNow system. So when someone goes in and tries to create a new contract or upload a contract, when you're looking for a vendor, you may have 15 vendors, and it's anyone's guess as to which one that you would actually want to select to be able to tie that new contract back to the original master. So that was a really, really big challenge for us, is getting all those vendors cleaned up and getting the data in the old contracts updated correctly.
Agreed. And thank you, Jeff. I think if I'm hearing you both right here, I think, again, taking it towards more of the best practices towards implementation, the first point that comes out is categorically, yes, let's look at the data that we are going to migrate from the legacy ones into tools like Aavenir when you change your platforms, right? So understanding whether we are taking the same garbage and putting that in again. Second is limiting customizations, because the tool that you're targeting as Aavenir in this case may be giving you 90% of the coverage. There is no really need for customizations, right? So wonderful. That's really insightful. Extending the same question about your experience, right? Now, when you look back and see the collaboration with Aavenir, what really stands out in terms of be the product, the process, people? Do you see any specific advantages that you could leverage, or there are areas of improvement for organizations like Aavenir? What has been that experience?
I think one of the things that stuck out with me was because we were asking for so much customization, the support we got was surprisingly good. As far as, we didn't get any pushback that I can recall for any of the changes that we wanted to make. So that was kind of refreshing, but in a way I wish you had pushback, because we ended up going a little too far with the customization in some areas. Dug our own hole.
Yeah, and I think what we were looking at was this was the process of how we were currently doing it. So we were like, oh, we need to customize to match this, and we need to customize like this. Where in reality, looking back, I would have looked at my team and said, why can't we do it the way that the system's set up? What about our process allows us not to do it that way? So I think looking back, the contract life system cycle was already set up. We needed to follow that more than we needed to follow what we were already doing, because how we were doing it necessarily maybe wasn't best practice. And the system was set up to be more aligned with what is best practice for the industry.
Wonderful. And I think, again, that helps me to recall the experience here, Kristen. I remember that we started off with surveys first, then we looked at the repository. Of course, this whole data cleanup and all that was part of that. And then finally, we decided we will touch authoring, right? Now, when you look back, or even while we are rolling out authoring in Kettering Health, what do you think? Was that sequence right, or you would have done things differently if given a chance? Again, a question for both of you.
Well, I mean, we didn't have an option when we started out because of timing. So our old system was going away. We were coming up on the end of a contract year for ACHC contract compliance. So we had to get our surveys ready to go out. So we kind of stood things up in sections. And our first thing we stood up was surveys. Once we got that in place, then we continued to work on cleaning data, getting data in, while in the background, we were working on matching fields, matching the system, customization. We didn't really have a choice in that piece. As far as, I think had we had cleaner data, I would have preferred to bring it up all at one time instead of it being in the chunks that we've had to do it in. But being that our data was where it was, we just didn't really have that option to do that.
Another thing that another thing that really complicated our implementation was the system that we had before actually went out of support. So we lost access to that system in November of 2022. And as Kristen mentioned, we had tried to implement another application, and I think we tried to launch that in the fall of 23. It took that long to try to get it to the point where we thought it might be ready, and it did not go well. So we ended up having to shift gears and look for another application about the beginning of the year, 2024, when we started looking at Aavenir. And as Kristen mentions, those surveys were really our deadline. We had to have those surveys out by the 1st of September. So that was our main focus.
Yeah. Speaking of value, now that we have implemented it, and of course, surveys are done, repositories there, of course, third-party contracts have been uploaded, and the system is actually building up with the repository per se. I'm sure post-activation, practices or processes are also done in the tool. Now, if you look back and again, or rather even your as a continuous assessment towards the value for your money and time and effort invested, what stands out in the product or maybe in the process that is being enabled by using Aavenir? What areas you would say that these are the value aspects by working with Aavenir or using Aavenir too?
I think one of the values is that once we get our users, used to going to one location, they'll be out of email, back and forth with email. They'll be able to go in one site to submit something that is already signed. They can submit something that needs reviewed. They can go there and access any of their contracts. So just having that one location where everyone can go to get a full service on their contracts is, I think, one of the big benefits of this compared to what we had.
Absolutely. We have not experienced the full benefits yet because we are not utilizing it fully. But I do believe once we get to that point, to echo what Jeff said, the ability to go in, start a contract in the system and run it all the way through to signature, it's written there. And then as you go through with updates or things that come about for that vendor throughout the year, you have one place to load it to, so that when you have a renewal coming up on that vendor, you can clear the data you need on that particular vendor to deal with you before you do that renewal even. So I just think that the ability of everything being in the same place is going to be our biggest benefit.
And those, I think it can be safely presumed that it would basically, if I want to quantify it, it can go in, time efficiency, then of course, ultimately resulting in cost efficiency and things like that, right? Because we are accelerating the process in a manner where people don't have to search, hunt for things, and then it becomes easily accessible at one uniform platform, right?
Absolutely. So one of the other things is we do not do our physician contracts in my department. That we, with the ability of ServiceNow, Jeff was able to set it up with the help of Aavenir that the department that handles those contracts can work through ServiceNow and automatically upload into the Aavenir system so that AI can do its magic and pull the correct information. So with minor keystrokes from my team, we can get those in the system to where they need to be, so we are getting everything housed in one place. That's going to be our other big benefit from all this.
You are absolutely reading my mind here, Kristen. I was about to come to the AI world and AI side of it, and you actually touched upon this. Just being curious, right? What's your take on AI in CLM space? What do you think? How would it start unfolding it?
I think there's a lot of growth still in that area. I think that one of the things you guys have reminded me about multiple times in this process is that the AI, the system, the AI will continue to learn. So the more we upload, the more we run it through the AI system, the more it sees, the more it learns. Naivety again was that I thought, oh, it's AI, it's supposed to do its thing, and it's just going to automatically know everything, and not realizing, even though you guys said it, it had to word. So it'd be like, well, it's not picking this up right, or it's not picking this up right. But we are noticing already, the more we upload, the more it's picking up, it's learning, like you said it would. So I think that there's still growth in that area, but I think it will help with the intake process. So it'll be a little bit less manual for our team when they're having to add in executed contracts specifically.
Jeff, your point of view around AI?
I really would just echo what Kristen mentioned, because I know when we first started using the contract, when we would run through and try to pull out who the vendor was, it would pick out every little piece that could potentially be a vendor. So it made it difficult to select the correct one. They'd have to go through and filter through that. But as we've implemented more, like Kristen says, it's getting better. Those lists get better and better. So kind of interested to see how it, not only uploading the contracts, but I know there's some AI functionality when you go to search. You can say, give me every contract that was signed in October with this term in it. So having that functionality or that capability for our end users that are looking for contracts will be very valuable.
Well, and the other thing I was thinking about with the AI is if we have a contract term that changes. So I'm, using something very minor, let's just say HIPAA, and the HIPAA law changes, that we need to affect every contract that has that HIPAA language in it. We can use that AI to go, these contracts have HIPAA, these contracts don't. Maybe we need to add it to these contracts, and we can pull the data based on that AI that has been put in the system. So I think, as we continue forward, you could pull a list that says we need to update all these contracts to the new to this new language. And I said, once it continues to learn, I think that'd be a huge benefit to us as well.
Awesome. Yeah, I think these are kind of use cases that we also are, from the product standpoint, we are trying to add those in our upcoming future releases. But I'm glad that you brought those scenarios, right, that can help Kettering in near future. Taking it towards the end of the conversation, Kristen, again, a quick question about what would be your advice to other supply chain leaders, right, when they're beginning with the implementation for such a tool, right, particularly, again, revolving around the CLM space. I would like to hear it from you from the business standpoint, and then same question coming to you, Jeff, from the IT perspective, right? How would you give those kind of guided notes to others if they want to embark on this journey?
Customize less would be my number one piece of advice, honestly, because it would, I just had in my head, well, that's not how we do it. We do it like this, and this is what we're used to. And that is probably my biggest regret, is that we customized as much as we did. I mean, you guys are gracious and let us do that, but I would customize less.
And from my side, I kind of mentioned it before, but the data cleanup, the vendor files in ServiceNow, making sure you get good, clean vendor files. I know that we talked also about the data. When we pulled the data from our old system, we had different field names. So one of the things that I don't know if we could have done, but maybe we should have done, was to try to map those field names into the existing Aavenir field names. Because I think what we ended up with is fields that are named very similar, but just slightly different because one name came from the old system and one was the existing name in Aavenir. So it's a little confusing when you go to search for contracts because we have some field names that are similar and you don't know which to select. So those are the two big things that, actually three, the data, the vendors, and then making sure that the mapping into the existing fields happens.
Wonderful. So if I want to really sum it up as the best practices, we would start with doing any customers who wants to really embark on a digitized solution for their CLM needs. Um, we can certainly suggest that. One is first do your homework, maybe the housekeeping activity of data cleansing, understanding mapping, and things like that. Second is be ready to be flexible for the processes that can be needed to alter, not necessarily we have to adhere to what they're doing today. Just again, triggering the point that you mentioned, Kristen, that it demands for customization. See what Aavenir can offer as a tool, see whether there is a flexibility that you can change certain processes and leverage the out of the box product, so that you also see some kind of possibility of using the process workflow in a manner where you can optimally get maximum out of that product workflow that has been designed, considering that it is an offering for the CLM space, right? These are the major two takeaways I would say towards the best practices. Thank you once again. It was wonderful talking to you both. As always, very constructive and very insightful. We look forward to a long-term association with you all, keeping you satisfied on the product, processes, and people. And we look forward to, again, a healthy relationship. Thank you, both of you, for giving your morning time with us today.
You're welcome. Thank you.
Thank you. Bye-bye.